Just a nurse. That's what Dr. Mercer called her in the hallway outside the ICU, his voice pitched like a tank idling in a garage, loud enough for the residents to hear, quiet enough to deny he'd meant for her to. They didn't know Katie Morrison had spent for years in Kandahar performing emergency thoracotomies by headlamp in 130-degree heat while mortar rounds shook the forward operating base. They didn't know she held a Silver Star citation locked in a safety deposit box 2 miles from here, unframed, unsigned, classified. What they knew was what they saw, a 31-year-old trauma nurse in blue scrubs with surgical scars across her knuckles, eyes perpetually cast down, moving through St. Michael's Hospital in Denver like she was trying not to take up space. She had been placed here 6 months ago by Air Force Special Ops to quietly investigate something the Pentagon had noticed, unusual mortality patterns in the ICU that aligned with inflated billing codes. Nobody moved like they were carrying secrets. Katie Morrison did. She arrived at the hospital at 6:56 a.m. on a Tuesday in January, same as every Tuesday for the past 183 days, parking her 2019 Subaru Outback 3 rows from the employee entrance because she never took the close spots. The snow had started again overnight, fresh powder covering the asphalt like a temporary amnesia. She stood in the parking lot for exactly 7 seconds before moving, the kind of pause that came from having already survived worse. Inside her locker on the 3rd floor, tucked between her stethoscope and a spare trauma shear, was a triangular folded flag from Martinez, her teammate, her friend, the man she'd held pressure on for 4 minutes before the medevac arrived to collect what was left of him. The flag had been sitting in that locker for 218 days. She never looked at it directly. She didn't have to. She could feel it breathing. The ICU morning briefing started at 7:15 a.m. Katie stood at the back of the cluster of residents and attendings while the night shift nurse, Marcus, gave report on the 7 critical patients. Ventilators wheezed their mechanical rhythm in the background, steady as a metronome. The monitors sang their electric pulse above each bed. Patient in Bay 7 had been transferred down from the military liaison office downtown, a colonel with the rank insignia of Air Force Combat Rescue. Chest trauma, multiple shrapnel wounds, admitted via Peterson Air Force Base with a medical hold that Katie had seen only twice before in her entire career. When Marcus said the name, Colonel Theodore Hayes, 160th saw Night Stalkers, Katie's pen stopped moving against the clipboard she was holding. She didn't look up. She never looked up during these briefings. Looking up was how people noticed you. Noticing you was how people remembered you. But her hands had gone very still, the kind of still that came from 4 years of muscle memory training her body to conceal everything her mind was processing. The Night Stalkers were the 160th Special Operations Aviation Regiment. Combat rescue meant he'd been a halo jumper, a combat medic, the kind of operator who went into situations that didn't have clean exits. Kandahar had a Night Stalker detachment. The chart noted his wounds were consistent with performing field triage under fire. She'd trained his predecessor, a lieutenant named Jackson who'd rotated out after his first tour. Hayes must have been his replacement. The pieces fit together like sutures closing a wound. This wasn't coincidence. This was why she was here. Dr. Mercer entered the ICU at 8:33 a.m., his white coat tailored to emphasize shoulders he'd never earned, his badge clipped to the left side with a kind of precision that suggested he polished it every morning. Grand rounds were scheduled for 8:45. Katie had already checked the charts for the 7 patients, vitals stable, medications on schedule, 2 new infections flagged from the labs that Marcus hadn't mentioned. She moved to the medication cart and began pulling for antibiotics for the patient in Bay 4, her movements economical, practiced, invisible. The fluorescent lights above hummed their constant frequency, the background radiation of hospital life that nobody really heard once they'd been here long enough. The residents formed their orbit around Dr. Mercer like planets that had forgotten they were supposed to have their own paths. 15 of them, medical students, interns, junior attendings from a dozen training programs across Colorado, all of them holding tablets with patient information they'd clearly skimmed in the elevator. Mercer stopped at Bay 3, where a septic patient had been admitted overnight with what looked like a surgical site infection from a routine cholecystectomy. Katie had charted the patient's fluid intake, her medication administration, her vital signs every 2 hours. The documentation was meticulous, exact, the kind of charting that never got anyone in trouble because there was nothing to find fault with. But that wasn't how Mercer approached these things. He held up the chart on his tablet, turning it toward the residents like he was showing them a teaching moment. "Look at this documentation," he said, and Katie's name was still on the screen, visible from across the bay. "This is sloppy charting that costs this hospital money. Insurance reviews flags like this and it triggers audits. This patient's reimbursement is being held because someone," and here he gestured vaguely in Katie's direction without looking at her, "can't manage to write clear timestamps on medication administration." The residents laughed. Not all of them. One woman in the back looked uncomfortable, and an older Asian resident who looked like he'd been through this kind of thing before kept his eyes on his tablet, but enough of them. The sound of laughter in a hospital was different than laughter in other places. It was meaner. It traveled differently. It stuck to things. Katie finished drawing the antibiotics into the syringe. 1.5 grams of piperacillin tazobactam, Z-track administration into the central line every 6 hours. She documented the time, the dose, the patient response. Everything correct. She stepped back from the medication cart and moved toward Bay 4, keeping her body language flat, her face the careful blank of someone who wasn't listening. That was the thing about being invisible. People talked around you like you weren't there. By 10:15 a.m., the humiliation had reached the vending machine on the second floor, which was where Mercer seemed to do most of his real work. Katie had come down to get water, actually to get away from the ICU, away from the knowing way Colonel Hayes's unconscious body was lying in that bed, away from the flagrant wrongness of seeing a name she'd trained attached to a patient file in her hospital. The vending machine hummed its electronic drone. She was reaching for the bottled water when Mercer's voice cut through the fluorescent hum like a blade. "The problem with nurses like her," he was saying to the residents who'd followed him downstairs, his tone conversational, almost friendly, "is they don't understand that documentation isn't busy work. It's the legal foundation of everything we do. And when someone decides that their shift is more important than accuracy, that creates liability. It creates compliance issues." Katie's hand rested on the water bottle but didn't pull it. "I've been in this hospital for 17 years, Mercer continued, and now there was no way to miss that he was performing, that every word was calibrated to travel just far enough for her to hear. I've seen how one careless nurse can trigger an insurance review that impacts the entire department. One person's negligence becomes everyone's problem." She pulled the water bottle free and fed $2 into the machine. The plastic clattered into the retrieval slot. The residents were quiet now, some of them recognizing that this wasn't teaching anymore, this was something else. This was a knife, and it was being wielded with the precision of someone who'd been sharpening it for a while. When Katie turned, she was holding the water bottle with a grip that would have crushed it if her hands had been trained for that kind of mistake. But they were trained for other things. Her eyes met Mercer's for exactly 1 second before she moved past him toward the stairs. That second contained everything her face didn't say. "I heard you. I'm still here. I'm not leaving." The ICU at 11:16 a.m. was running a different kind of pressure. The patient in Bay 7, Colonel Hayes, had developed an arrhythmia on the monitor, nothing dangerous yet, but the kind of thing that happened sometimes when patients were coming up from sedation, when their bodies were starting to remember what they were supposed to do. Katie was at his bedside when Mercer appeared, and she was reviewing the code on his EKG strip, the rhythm still irregular but trending better as the propofol drip came down. Sinus rhythm was returning. It would be fine. "His discharge codes are billing as emergency intervention," she said quietly. She didn't ask permission. She simply spoke to the cardiac monitor, to the patient, to the thin space between them and Mercer. The billing codes in the new system might warrant a compliance audit. Those interventions looked more dramatic on paper than they were in practice. The room went quiet. Not the normal hospital quiet, the quiet that came right before something broke. Mercer's face didn't flush immediately. It drained first, the blood receding like he'd been shot, and then it came back red, florid, the color of something wounded and dangerous. "Are you suggesting," he said, and his voice had changed now, the performed tone gone, replaced with something raw beneath, that you have any expertise in billing codes. That you have the qualifications to audit my documentation. Katie turned from the monitor. She was holding the EKG strip in her left hand, the one with the surgical scars across the knuckles. I'm suggesting that these codes might need review by someone other than you. Get security. Now. He was pointing at one of the residents, who looked immediately uncomfortable. This nurse is being insubordinate. This is exactly what I'm talking about. This is the problem. I will not be questioned by nursing staff regarding medical decisions that I have made. Katie set the EKG strip down on the bedside table beside Colonel Hayes's for pump. She stood very still, the way you stand when you're in a room with something that might bite. Her breathing didn't change. Her expression didn't change. What came next was a single tear that escaped from her right eye and traced a line down her left cheekbone, and she wiped it away without breaking eye contact, the movement so precise and economical that it could have been a practiced gesture, something she did every morning in the mirror. I've seen braver men than you break under less pressure, doctor, she said. The words were quiet. They weren't whispered, they were just spoken at the volume of someone having a conversation. They were also the kind of words that created rifts, that split seconds into before and after. One of the residents sucked in a breath. Marcus, who was charting by the central station, looked up from his computer. Katie turned and walked back to her station, leaving Mercer standing at the foot of an unconscious patient's bed, his hands clenched at his sides, his face the color of someone who had just been seen. Behind her, no one moved. No one breathed. The ventilator wheezed. The monitors hummed. And in Bay 7, Colonel Theodore Hayes lay unconscious with his chest tubes draining clear fluid, unaware that the woman standing at his bedside was the reason she'd been sent to this hospital in the first place. She pulled his chart and began to read. Winter storm warning scrolled across the hospital's emergency broadcast system in red text that nobody in the ICU seemed to notice. Katie Morrison stood at Bay 7, watching the crawl. Winter storm watch upgraded to winter storm warning, effective 2,100 hours through 0600 hours tomorrow, accumulation 14 to 18 inches, gusts to 35 miles per hour. The meteorology didn't concern her. What concerned her was Colonel Theodore Hayes's chest tube output, which had turned the color of weak tea instead of clear, and the infection markers climbing like a fever chart on a dying patient. She pulled his chart from the electronic system and scrolled through the last 72 hours of orders. Dr. Mercer had written a medication change on Tuesday at 2,247 hours, a switch from the empiric broad-spectrum antibiotic that should have been covering him to something narrower, something that left vulnerabilities. The kind of vulnerability a doctor wouldn't write if he was trying to save a patient. The kind a doctor writes if he wants to watch one deteriorate just enough to justify another emergency intervention, billable at the highest tier, the kind that pumps reimbursement rates up. Katie's jaw tightened. She knew that pattern now. 3 weeks of watching the ICU's mortality records had burned the shape of it into her memory like a scar. Patients admitted under Mercer's care who should have been discharged, they declined instead. Slowly. Consistently enough to be tragic, inconsistently enough to look random. Complications that arrived right on schedule for maximum billing codes. A 47-year-old with pneumonia who coded during the night shift when Mercer was running the floor. A 63-year-old post-op from routine appendectomy whose drain output never cleared. A veteran with a simple infection who spiked a temperature of 106.8 degrees at 0300 hours. All of them under Mercer's orders. All of them billed at level for all level 5 emergency interventions. All of them dying on his shift. She photographed Hayes's medication order with her phone, the one she never carried on her regular scrubs, the one with the encrypted number in the contacts and the Pentagon seal on the lock screen, and sent the image to a number that didn't exist in any hospital system. The message went nowhere and everywhere simultaneously. That was the architecture of her real job. Hayes stirred in his sedation. His eyelids moved but didn't open. The ventilator wheezed its mechanical rhythm, pushing oxygen into his lungs at 14 breaths per minute, and Katie watched his chest rise and fall with the precision of a metronome. His face had that peculiar slackness of induced unconsciousness, lines erased by propofol, the slack of a man whose body was being held together by machines and someone else's vigilance. His left hand rested on the mattress, knuckles scarred from something that looked like 30 rounds downrange, each small white line a story she would never ask him to tell. In break room, the hospital's IT specialist, Rodriguez, according to his badge, a quiet man with a navy anchor tattoo visible on the inside of his forearm like a secret only sleeves could hide, was refilling his coffee when Katie came in. "Bad night coming," he said. "Not a question." "Always is," Katie replied. Her voice was flat. That was her armor, the flatness. It made people underestimate her. He paused with the coffee pot hovering over his mug. "I notice things. Server logs. Files that get deleted. Files that aren't really deleted, you know? They're still there if you know where to look." He poured carefully. "Just so you know." Their eyes met. His were brown and intelligent and terrified. He knew something. More than that, he was telling her he knew something, which meant he'd already figured out what kind of woman she was. Or at least what kind of woman she wasn't. She nodded once. Rodriguez turned back to his coffee and said nothing else. That was the language people like them spoke, complete sentences in glances. The hospital's lights flickered at 1847 hours. Just once. Just enough to register on the retinas. Katie was at Hayes's bedside when it happened, adjusting the line that was running normal saline and something else that wasn't listed on any chart. She steadied herself against the bed rail. The backup generators hummed to life with the sound of a distant armada, all diesel muscle and emergency power. "Just the storm," one of the day shift nurses said from the hallway. "Happens every time we get bad weather." Katie didn't answer. She was checking Hayes's vital signs, the ones that mattered, not the numbers on the screen but the ones her hands were reading, perfusion in his nail beds, the color of his lips, the resistance in his chest as his lungs expanded. He was holding his own. For now. At 19:03 hours, Dr. Mercer appeared. His presence came before him like a pressure change, the air seeming to thicken and cool. He wore his confidence like a tailored coat, expensive, perfectly fitted, the kind of confidence that came from knowing exactly what people owed you. "I'm moving you to nights next week," he said to Katie without preamble. Not a request. A declarative sentence that bent the world toward his preference. "I'm assigned to ICU," Katie replied. "Not anymore. I need staff I can rely on." He glanced at Hayes's monitor, made a notation in the chart, and turned away before Katie could respond. The reassignment was elegant in its cruelty. It was also transparent if you were watching the right lines. Get her away from Hayes. Get her away from the medication orders. Get her away from whatever she was noticing in the billing patterns, because something had changed in her questions and her silences. She had started suggesting audits. She had stopped being frightened. Frightened people asked no questions. Confident people asked everything. Katie returned to her locker after her shift and opened the lower door. Inside was a cardboard box containing things that no civilian nurse would carry, a compression kit with Israeli bandages, tourniquets, a tactical flashlight that weighed more than it should because of what was threaded inside it, medical supplies that belonged to a different kind of deployment. She reached in and felt for the pen that wasn't a pen, the one with a ballpoint on one end and an encrypted burst transmitter on the other. It was there. It was always there. Just like the go bag itself was always packed, never fully unpacked, ready for extraction or escalation or whatever came when the civilian cover started fraying. She pulled her locker door closed. The sound of metal on metal echoed through the empty hallway. Down in pediatrics, a child cried. The fluorescent lights buzzed overhead like insects trapped in amber. Outside, snow began falling in sheets so thick it erased the parking lot entirely. Katie checked her watch. 2,203 hours. The storm was just beginning. The wind outside shook the ER doors like a thing alive and angry. And somewhere in Bay 7, Colonel Theodore Hayes was breathing on a ventilator while Dr. Mercer's medication change worked its slow chemistry against him, and Katie was no longer positioned to see it happening. That wasn't an accident. That was a calculated move. Which meant Mercer knew. Not everything, but enough. He sensed the threat in her presence the way a predator senses another predator on its territory. She walked back toward the ICU for one final check before leaving. The night shift nurse, Stella, reliable and observant, was settling Hayes onto his side to prevent pressure ulcers from developing. Katie watched for 30 seconds without speaking, just watching the transfer of care, the passing of vigilance from one set of hands to another. "He's stable," Stella said without turning around. "I'll keep close tonight." "Thank you," Katie said. And then, because something in her voice needed to warn this woman without violating the architecture of her cover, if anything changes, anything at all, you call for help immediately. "I always do." Katie left the ICU at 2,247 hours. The storm had intensified. The parking lot was already white. Her breath fogged in front of her face as she walked toward her car, and she realized something had shifted. The chess game had just advanced one move. Mercer had removed her from the board, which meant he was confident he could maintain his position without her watching. Which meant something was about to happen. The kind of something that required her to not be there to prevent it. At 9:27 p.m., the lights died. Not a flicker. Not a dimming. A complete severing of power that made the ICU's fluorescent ceiling panels go black in an instant, as if someone had flipped a master switch on the world. The backup generators caught with a diesel rumble that Katie felt in her sternum, a sound like a warbird stirring in its nest. For 3 seconds, the ICU ran on that reserve power, ventilators cycling, monitors beeping their electronic heartbeat, and then the generators sputtered. Once. Twice. Then nothing. The darkness that followed wasn't total. Emergency battery strips along the floor glowed a sickly green, casting the ICU in the kind of light that exists nowhere in nature, not night, not day, something between death and diagnosis. Alarms began their cascade immediately, a discordant symphony of monitors losing their connection to mains power, feeding tubes shutting down, pressure cuffs deflating mid-cycle. Voices shouted. Footsteps scattered. Someone was calling for flashlights. Someone else was paging the chief of engineering. Katie was already moving. She had been in pediatrics on the 3rd floor when the power died, standing in front of a vending machine that had trapped her dollar bill in its mechanical throat. The moment the ICU alarm system switched to battery backup, that specific 3-note cascade that meant critical infrastructure failure, her body had responded faster than thought. She was down 2 flights of stairs before her conscious mind had finished forming the reason why. Old training. The kind that lives in muscle memory and doesn't wait for permission. Hayes was in bed 7. She knew his room the way she knew the feel of a trigger, the way she knew the specific weight of a trauma shear, the way she knew the difference between arterial bleeding and venous because one sounded like fate and the other sounded like chance. The emergency lighting threw his features into shadow and highlight, his face the color of old paper. His ventilator was on battery backup, cycling its mechanical breathing, but even in the darkness she could see his chest rising and falling wrong, shallow, irregular, panicked. His oxygen saturation monitor beeped once. Then again. Then faster. Katie's phone flashlight snapped on in her trembling hand. Not from fear. Not from doubt. The trembling was restraint, every nerve firing at once, every system demanding to move faster, to act now, and her conscious mind holding them back by a thread so thin it might snap. She was beside his bed in 4 steps, her hands already assessing, already knowing. His ventilator readout showed the battery indicator flashing red. 87%. The numbers were dropping. Katie. It was Marcus, one of the ICU nurses, his voice high and thin in the darkness. The doctor? Have you seen? Manual bagging, she said. Not a question. A direction. Now. The ambi bag was in her hands before Marcus could answer. She disconnected the ventilator from Hayes's endotracheal tube with the kind of smooth efficiency that made her movements look casual, unremarkable, the work of someone who'd done this 1,000 times before, which was true, though not in any way St. Michael's Hospital would understand. The bag itself was soft, compliant, responsive. She began the manual rhythm. Squeeze. Release. Squeeze. Release. Her compressions were precise, measured, the kind of steady that can only come from someone who's kept a man breathing while rounds landed 300 meters away. Hayes's oxygen saturation climbed slightly. 89%. Better. Not safe, but better. And then she felt it. A warmth beneath her left palm that had nothing to do with Hayes's fever. She pulled back the dressing on his chest, and her flashlight beam caught what her hands already knew. Saturated. Absolutely saturated. The gauze was dark red, nearly black in the emergency lighting, and underneath. The incision. The surgical line where the trauma surgeon had closed him after the shrapnel removal had opened. The intercostal muscles were visibly separating along the closure, the edges gaping like a mouth trying to speak. His chest was moving wrong because something inside him was moving wrong, shifting, bleeding into the space between his ribs where blood had no business being. Internal hemorrhage. The kind that kills quietly, the kind that takes a man from stable to exsanguinating in minutes if you're not looking. If you're not there. If you're stuck on the 3rd floor reassigned to pediatrics. "Where's Dr. Mercer?" someone shouted from across the ICU. Katie didn't answer. She was scanning the monitors, reading the silent language of a body in crisis. Hayes's heart rate was climbing, 123, now 127, now 131. His blood pressure was compensating for blood loss, pushing hard, trying to maintain perfusion to his brain. That compensation would hold for maybe 3 minutes before his body realized it was fighting a losing battle and began to fail. The rhythm on the cardiac monitor was still sinus. Still organized. Still salvageable. "Dr. Mercer," the nurse called again, louder now, moving toward the call bell. Katie grabbed the sterile tray from Hayes's bedside table. Her hands moved on their own, no hesitation, no second guessing. The crash cart had arrived, she could hear the wheels squeaking across the tile floor, the defibrillator being wheeled into position, but without main power, the defibrillator wouldn't charge. It wouldn't work. Nothing would work except what was in her hands and what was in her training and what was burning in her chest like a scar that had never quite healed. The scalpel was there, where it should be. 14-gauge needle for the thoracostomy drain. Clamp. Dressing. Everything a field thoracotomy required, laid out and waiting like a confession. "Katie, we have to wait for Dr. Mercer." It was Marcus, his voice urgent now, touching her arm. We can't do a procedure without." "Step back," Katie said. Her voice didn't sound like it belonged to her. It sounded like someone else, someone who had held a man's heart in her hands in a blast shelter outside Kandahar while rounds impacted the concrete wall 3 feet away. Someone who had made peace with the choice between protocol and survival a very long time ago. Marcus stepped back. Hayes's heart rate was 141 now. His oxygen saturation was dropping again, the numbers falling like a countdown. The dressing on his chest showed fresh blood pooling at the edges. He was exsanguinating. Not slowly. Not with time to wait for an attending physician who was conspicuously absent from a unit full of critical patients during a hospital-wide power failure. Not with time to follow the chain of command and proper procedure. Pain was information. And right now, his body was screaming. Katie positioned herself at his left anterior axillary line, second intercostal space. The location was muscle memory, 18 years of training, 100 combat surgeries, 1,000 hours of simulation burning into neural pathways until the body knew what to do before the mind had finished asking. She prepped the skin with the iodine from the tray, her movements precise as surgery, which is what this was, surgery, emergency medicine, the kind of procedure that lived in the space between protocol and triage. She picked up the scalpel. The moment before you make an irreversible decision feels like the moment before a jump, that instant where you're still on solid ground, where you can still change your mind, where the next action will determine everything that comes after. Katie stood in that moment for perhaps one heartbeat. Then she moved. The blade went in with a surgeon's precision, not a desperate hack, the kind of cut that comes from someone who understands anatomy the way a musician understands an instrument. The resistance of skin, the yield of muscle, the feel of the pleural space opening like a secret. Blood poured out, more than she expected, dark and urgent, and she worked fast now, opening the space wider with the blade, her hand steady as a surgical laser as she positioned the drain, the needle, the clamp. His oxygen saturation jumped. 91%. 94%. The pressure dressing was going on now, her hands moving with the fluid precision of someone who had done this while sand was blowing through a concrete bunker, who had done this while artillery was shaking the walls, who had done this with nothing but training and the refusal to let a brother die because of paperwork. "Get me a trauma monitor," she said. 12 lead EKG. Baseline labs. Type and cross if we have generator power. Not requests. Commands. Marcus was moving before she finished speaking. Hayes's heart rate began to drop, 140, now 135, now 128. The number settling like a bird returning to rest. His oxygen saturation climbed to 96. His blood pressure, which had been compensating hard, began to normalize. The man's body, given what it needed, was remembering how to live. Katie stepped back from the bedside. The emergency lighting cast everything in that sickly green, and she became aware of the silence. Not absence of sound, the ventilator was still cycling its battery-powered rhythm, the cardiac monitor was still beeping, rain was hammering against the windows outside like a fist demanding entry, but the absence of voices. Of movement. Of anyone else speaking, acting, deciding. Everyone was staring at her. "The doctor will arrive any moment," someone said quietly. Katie didn't respond. She was washing the blood from her hands using the emergency water container, watching it swirl down the drain. Her phone flashlight was still on, held between her teeth, and her face was cast in sharp relief, the kind of light that shows every scar, every angle, every decision etched into a jaw that had learned not to break under pressure. The question hanging in the darkness was obvious. Unspoken. Impossible to ignore. "How did you know how to do that?" Katie didn't answer. Not yet. Not in a way anyone in this ICU would understand. She moved to check Hayes's airway positioning, her movements sure and economical, the work of someone who had moved past fear into a place where only competence existed. Her hands were steady. Her voice, when she spoke, was absolute. "Prepare for transport to OR. He'll need vascular evaluation once we have main power. If Dr. Mercer can't be located, page trauma surgery directly. Don't wait." She pulled on fresh gloves. "This patient is my responsibility now." And that was when everything changed. That was when the first door in a locked building swung open, though Katie wouldn't know it for nearly 24 more hours. The wound had split like a seam coming undone. Katie could see the intercostal muscles separating in the darkness, the surgical line gaping open as blood pooled into the chest cavity. The backup generators were still struggling to engage, the ICU hung in that terrible liminal space between full darkness and functional light, where nothing felt quite real. She didn't hesitate. She reached for the scalpel from the crash cart, her movements precise and unhurried, the kind of calm that comes from having already survived worse. Her phone was duct-taped to the bed rail, its flashlight beam cutting through the shadows like a surgical spotlight. Someone had to maintain the field of vision. She had already decided it would be her. "Someone bag him." "Now," she said, her voice pitched low and even. A resident frozen in shock finally moved, muscle memory overriding panic. Katie positioned herself at Hayes's side, scalpel in hand. The blade caught the pale fluorescent glow trying to push through the emergency lights. She could feel every surgery she'd ever performed in a tent in Kandahar flowing through her hands, the mortar rounds landing 200 meters away, the screaming, the sand in everything, the knowledge that hesitation meant death. This was different only in the air conditioning and the sterile equipment. The procedure was the same. The stakes were identical. She opened the chest cavity with 3 precise cuts. The ribs separated like pages turning in a book. Her hands moved with a precision that belonged to someone who had done this 1,000 times in a war zone and never once on the comfortable side of a hospital. The bleeder was small, an arterial tear, maybe 3 millimeters, bright red and pulsing. She clamped it with a hemostat, her fingers steady as a surgical laser. Then she placed her gloved hand directly on Hayes's heart, compressing manually to maintain circulation. The muscle was warm and slick beneath her palm. 1 minute. 2. Her shoulder screamed with a burning that felt like shrapnel, but her hand never wavered. She had trained for this. She had lived this. She was living it again now, in a hospital 3,000 miles from where it had first mattered. 3 minutes and 40 seconds into manual compression, the backup generators finally engaged fully. The ICU lights flooded back to life like someone had switched on a sun. Monitors screamed to life around them, beeping their electronic resurrection. The ventilator hissed. The 4 pumps resumed their rhythmic ticking. Hayes's heart monitor settled into a steady green rhythm across the screen, sinus rhythm, stable, holding. Katie's hand was still inside his chest when Dr. Mercer walked onto the floor. He had a coffee cup in his hand. Steam rose from the lid in lazy spirals. His shoes clicked on the tile in that distinctive way that telegraphed his presence before she even looked up. When she did, she saw his face shift through 3 expressions in rapid succession: confusion, then recognition of what he was seeing, then something darker. Something like understanding. "What the hell?" he said, the words coming out as a question despite their delivery as an accusation. "He was bleeding out," Katie said, her voice level and factual as a medical chart. "Wound dehiscence. I stabilized him until power returned." Mercer's eyes narrowed into slots. Not angry, not yet. Calculating. He was already seeing how this could be weaponized, already measuring the distance between what had happened and how he could reshape the narrative. Katie recognized the look because she had been trained to recognize exactly this kind of tactical shift in human behavior. "Everyone out." "Now," he said, his voice pitched to carry authority and finality. The staff scattered like they had been detonated, the nurses and residents abandoning the ICU in a synchronized exodus that left only Katie and Mercer at Hayes's bedside. The monitors continued their electronic chorus. The ventilator wheezed its mechanical rhythm. Somewhere down the corridor, a code blue alarm shrieked in another unit, indifferent to the reckoning happening in this one. Katie carefully withdrew her hand, the hemostat holding, maintaining the clamp on the bleeding vessel. She set the scalpel down on the sterile field with deliberate precision. When she straightened, her eyes were dry and flat. Mercer leaned in close, his voice dropping to a register that only she could hear. "You just ended your career. That's practicing medicine without a license. An authorized surgical procedure on a conscious patient. I'm calling the chief of staff within the hour." "You weren't here," Katie said. "Not a question. A statement." "I was managing the hospital-wide crisis from the command center," Mercer replied, his smile sharp as a blade. "You were playing cowboy. In the dark. On a patient who's still under police investigation for his ICU admission status. That's not a save, Captain. That's grounds for immediate termination. I'll make sure of it." He used the word captain like it was a slur. Like it meant something different than what it did. Katie held his gaze without flinching, without the tremor of anger or fear that might have leaked into her expression. The trembling wasn't fear. It was restraint. By morning, she was sitting in the Human Resources office on the 4th floor, fluorescent light making everything look slightly diseased. A woman named Patricia from HR slid a single sheet of paper across a desk made of laminated particle board. The letterhead read St. Michael's Hospital, Denver, Colorado. The words underneath were written in that careful administrative language designed to obscure intent beneath layers of policy and procedure. "Gross negligence and protocol violations," it said. Unauthorized medical procedures performed beyond the scope of nursing practice. Risk to patient safety. Grounds for immediate termination effective immediately. The Chief of Staff hadn't even had the decency to call her in. Mercer had already shaped the narrative before anyone could ask her side of what had happened. The medical director saw a malpractice liability. The hospital's lawyers saw exposure. Nobody saw the patient who was still alive because Katie had cracked open his chest in the dark and held his heart together with the skill of someone trained to do exactly that under far worse circumstances. "You're entitled to a severance package," Patricia was saying, her voice the practiced tone of someone who had delivered this speech 100 times. "Given your tenure of 6 months, you'll receive 2 weeks of pay and continuation of your health insurance through the end of the calendar month. We can provide a reference letter if you need one, though I understand that may not be applicable in your case." Katie didn't respond. She signed the paperwork because there wasn't another option. She took the envelope Patricia slid across the desk. She stood and walked out of the office as if she were walking through water, each movement a conscious choice against the weight of everything that had just happened. By 6 in the evening, she was standing at a bus stop 3 blocks away from St. Michael's, rain hammering down like applause nobody had invited. The sky had turned the color of old bruises. The cardboard box was clutched against her chest, still relatively dry despite the storm, holding the specific accumulation of someone's 6 months of trying to belong somewhere. Inside the box, a cracked Air Force mug with her old unit's insignia from the 160th SAW Night Stalkers, faded gold lettering barely visible against the ceramic. A dying succulent from her desk, its leaves drooping like surrendered weapons. And beneath them, wrapped in tissue paper that had already begun to absorb moisture from the rain, Martinez's flag, folded into the precise triangle required by ceremony, blue triangle facing forward, each fold sharp enough to cut. Her phone buzzed. An encrypted message from her handler, the code sequence that had been her lifeline for the past 6 months, cover blown. Extraction pending. Mission incomplete. She watched the rain dissolve the ink on her termination letter, the words running like watercolors into abstract shapes. The bus approached, its headlights cutting through the downpour. The doors hissed open. She didn't board it. She stood at the stop, box held against her chest, watching the rain destroy evidence of her employment at St. Michael's Hospital. What happened next didn't just silence the room. It brought everything Katie had worked for in the dark to the surface, and it did so with the devastating precision of a military operation that had been planned not in minutes, but in years. The next morning would bring answers. The next morning would bring witnesses who remembered exactly what they saw in that ICU when the lights came back. The next morning would bring a general officer and federal agents and the truth, finally, stepping through doors that Katie Morrison had been ordered to keep closed for 6 months. But that night, in the rain at the bus stop, she was just a woman with a cardboard box containing the ghosts of her old life, waiting for the extraction that would make her disappear back into whatever role they assigned her next. She didn't know that Colonel Hayes was already awake in his hospital bed, his hand reaching for the call button not to summon a nurse, but to ask for pen and paper to write down everything he had seen in the darkness. She didn't know that Rodriguez, the IT specialist from the basement, was that moment transferring files to external hard drives, his Navy veteran instincts telling him that something catastrophic had just shifted in the hospital's foundation. She didn't know any of it yet. The termination letter sat on her desk at 6 in the morning, printed on hospital letterhead with the weight of betrayal. Gross negligence. Protocol violations. Practicing beyond scope. The words were precisely chosen, technically defensible, strategically devastating. What the letter didn't say was the truth: she'd saved a patient Dr. Mercer had deliberately allowed to die. The Chief of Staff's signature was there, but Katie knew whose hand had written the recommendation. Mercer had moved faster than she'd anticipated. By 7 a.m., she was clearing her locker, her name badge already deactivated, the magnetic strip useless in her pocket like a cancelled ticket to a show she'd never get to finish watching. The cardboard box was smaller than she expected. Her cracked Air Force mug, the one with the 160th SAW insignia she'd bought in Kandahar 13 years ago. A wilting succulent from a nurse's station gift exchange. And Martinez's flag. The triangle folded with the precision of a military funeral, the creases sharp enough to cut, the weight of it impossible to measure in ounces. His family had sent it to her, not knowing she was undercover, not knowing she'd been the one to hold his hand when he coded out in the field hospital in Loga province. She'd kept it in her apartment in a box under her bed for 6 months. Now she carried it like a relic, like evidence of everything she'd been trying to protect and everything she'd failed to save. That evening, the rain hammered Denver like it was trying to wash the city clean. Katie stood at a bus stop on Spee Boulevard, the cardboard box growing soggy in her hands, her scrub soaked through despite the small overhang that barely qualified as shelter. Buses passed. She didn't board any of them. A woman beside her asked if she was okay. Katie said nothing. The woman left. The rain continued its percussion against the asphalt, a sound like applause for a performance no one had watched. Her phone sat silent in her pocket, no messages from Mercer, no gloating, no follow-up. That was almost worse. It meant he'd already moved on, already forgotten her, already begun constructing his next narrative. She was just a nurse who'd overstepped. A problem that had been solved with a signature. The next morning arrived grey and military precise. 0600 hours. That's when the first convoy rolled into the St. Michael's parking lot. 2 Chevy Suburbans with government plates, the kind that moved through traffic without asking permission. Katie was at her locker for the last time, pulling her personal items, a photo of her mother, a spare pair of compression socks, the weight of finality in every gesture. She didn't hear them approach. She felt them. The air pressure changed when trained personnel entered a room, the same shift that happened in Kandahar when a QRF was rolling in. Colonel Hayes was awake. Actually awake, not the half-conscious medicated state from yesterday. He was sitting up in his bed in the ICU, his breathing still labored but his eyes clear, and when he saw Katie at her locker, 20 meters across the unit, he locked eyes with her with the intensity of a sniper marking a target. His mouth moved. 2 syllables, barely audible over the ventilator hiss and monitor beeping. Viper. That was her call sign from Kandahar. That was her operational identity from a life that was supposed to stay compartmentalized, sealed away from St. Michael's Hospital and nursing shifts and the careful construction of an invisible woman. Only people with clearance knew that name. Only people connected to the Pentagon. A brigadier general stepped forward, his uniform pressed sharp enough to draw blood, his voice filling the ICU like he'd trained it specifically for this moment. Captain Katie Morrison. Air Force Special Operations. Silver Star recipient. The words landed like shrapnel. For repeatedly exposing herself to enemy fire while performing combat trauma surgery in Kandahar. Her hand stilled on her locker door. The room, nurses, residents, respiratory technicians, everyone, went dead silent. The fluorescent lights buzzed overhead like they were amplifying the weight of what was being said. For actions above and beyond the call of duty in defense of American service members. The Brigadier General's voice didn't waver. His eyes didn't blink. This was a man who'd read citations at Arlington Cemetery enough times that the words had become his native language. Dr. Mercer materialized from his office like something summoned by the sound of his own doom. He was laughing, actually laughing, but it was the laugh of a man whose mind was fracturing in real time. Some misunderstanding. His voice pitched high and thin. These videos are out of context. Patient care decisions are complex. He was moving toward the Brigadier General the way prey sometimes charges at the predator, driven by panic more than strategy. Nobody stopped him. Nobody needed to. Behind him, the hospital's IT specialist, a Navy corpsman named Holloway who'd worked in the emergency department for 3 years and said maybe 10 words a month, stepped forward and handed a hard drive to the federal agents waiting by the ICU entrance. Their suits were dark. Their expressions were darker. The first video played on an agent's tablet, silent except for the timestamp crawling forward. 2:18 a.m. Dr. Mercer entering patient room 412. His movements methodical. His hand steady. He disconnected the cardiac monitor from the elderly man in the bed, a 74-year-old veteran named Robert Chen who'd been admitted 3 days ago with chest pain. The monitor's red light died. Mercer silenced the alarm with one touch. He stood there for 17 seconds, watching the patient's breathing labor, watching the oxygen saturation numbers fade from view, no longer alarming because there was no alarm to sound. Then he left. The timestamp jumped to 4:37 a.m. Mercer returning. Immediately ordering a full resuscitation setup, calling a code blue, performing chest compressions with the intensity of a man trying to save a life, authorizing every emergency intervention, every drug, every invasive procedure. The patient died at 4:51 a.m. The billing code that followed was for a catastrophic emergency resuscitation attempt on a terminal patient. Maximum reimbursement. The agent's voice was steady. That patient rescinded his DNR status at 0600 the morning before, the agent said. It's in the chart you didn't review. Another video. Another room. Another patient. Mercer reducing for pump settings at 2 a.m., decreasing the dopamine drip that was maintaining a patient's blood pressure, then replacing the original settings before morning shift arrived. The patient coded at 3:15. Another emergency resuscitation. Another maximum billing code. Another death that looked sudden and unexpected if you didn't know how to read the timeline. Another family that never knew their loved one's final hours had been choreographed. The Pentagon liaison stepped forward. A woman in dress blues with captain's insignia and the bearing of someone who'd been briefed on classified material that she could now, finally, speak aloud. Captain Morrison had been operating under deep cover to investigate Medicare fraud linked to veteran deaths, she said. The words were formal, precise, carrying the weight of institutional authority. Her investigation identified 17 suspicious deaths across 3 hospitals where Dr. Mercer held privileges. Each followed the same pattern. Deliberate neglect allowing deterioration. Then aggressive interventions that failed. Maximum billing for emergency procedures. Total fraudulent claims exceeded $4 million. Mercer's hands were shaking. Actual trembling. The voice that had dominated rounds and terrified residents was cracking now, fragmenting. Witch hunt. The word came out desperate. I'm a respected physician. But Colonel Hayes was sitting up in his bed, moving slowly, his voice rough from the endotracheal tube removal but absolutely clear. I was conscious enough to see you check my monitors and leave. His chest was bandaged where Katie's hands had saved his life. I was conscious enough to know you wanted me to die so you could bill for a dramatic resuscitation attempt. The accusation didn't need to be proven again. Everyone in the ICU had already seen it on video. Federal agents moved with the quiet efficiency of people who'd done this before. Handcuffs. Rights read in a monotone. The chief of staff stood beside them, his face the color of old hospital walls. Hospital attorneys clustered near the doorway like frightened birds. Mercer tried to run. Actually bolted toward the stairwell with the panic of a cornered animal. He made it exactly 3 steps before Holloway, the Navy corpsman, casually extended his boot into the hallway. Mercer crashed face first into the linoleum, his $1,000 tie fluttering, his perfect composure shattering into a sound like breaking glass. The handcuffs clicked closed. His sobbing echoed down the corridor, a sound nobody in that ICU would ever forget. 6 months later, Captain Katie Morrison stood in her office at Peterson Air Force Base in full dress uniform, the blue jacket pressed sharp enough to hurt, her ribbons aligned precisely. Martinez's flag hung in a shadow box on the wall behind her, finally honored with the respect it deserved. The folded triangle gleamed under office lighting, no longer hidden, no longer buried in a box under a bed. Through her window, the flight line stretched toward the Rocky Mountains, aircraft taxiing for training missions, engines screaming into Colorado sky. She wasn't trembling anymore. The hand that held Martinez's memory was steady. The hand that had saved Colonel Hayes was steady. The hand that had dismantled a fraud network affecting 43 veterans across 6 hospitals was steady. Hayes walked in without knocking, which meant he had clearance for this space now, which meant he'd been read into her next assignment before she'd even been officially briefed. The prosecution got convictions on all counts, he said. Mercer's license permanently revoked. Judge gave him a choice. Prison or community service. He chose service. Teaching CPR fundamentals at a community college in Westminster for minimum wage. 5 years. Katie nodded once. She'd expected worse. She'd wanted worse. But there was something worse than prison for a man like Mercer, the knowledge that he'd become invisible, that he'd lost everything he'd built, that he was now exactly what he'd made Katie into, a person nobody noticed, teaching life-saving techniques to students who'd never know he'd learned them specifically so he could weaponize their opposite. Hayes set down another folder. The fraud network extended to 6 hospitals. Your investigation shut down the entire operation. 43 suspicious deaths. Families getting answers. She opened the folder and saw the names, the dates, the pattern that only someone who'd been hunting it could have constructed. Hayes turned to leave, then paused at the door. For what it's worth, Captain, that night in the Blackout, I knew exactly who you were. We all recognize our own. He meant Kandahar. He meant the combat medic who'd become a nurse who'd never actually stopped being a soldier. He meant the person who saved lives by looking weak enough that nobody thought to stop her. When he was gone, Katie picked up her next assignment folder. Phoenix. A VA hospital. Medication discrepancies. Another pattern beginning. She'd learned something 6 months ago in a blackout, standing over a bleeding man in the dark. The quietest person in the room might be holding it all together. She'd learned it again during her termination, during the rain-soaked bus stop, during the moment when everything broke and everything rebuilt itself. She opened the Phoenix file and began reading. Her phone buzzed with authorization codes. Her new cover identity was already waiting. New scrubs. New name. New hospital. Same mission. The aircraft screamed past her window, climbing toward clouds, and Katie Morrison, Viper, Captain, the person who'd never been invisible, only patient, prepared for her next deployment. If you've ever been underestimated by someone who didn't know your full story, you need to watch more of these investigations. Like this video, subscribe to the channel, and comment, what would you have done in Katie's position? Because sometimes the bravest heroes are the ones nobody thinks to notice until it's too late.